Bismillah ar-Rahman ar-Rahim, my dear candidate for MRCS examination. I have very good news. Now we are able to say that we have a dedicated center for vascular and MRCS education, which is Vascular Art Academy, situated in New Cairo under the presidency of Professor Mahmoud Salah. It is situated in very nice place in New Cairo, in the center of medical city, and these are the staff which are going to help you in your career to pass your exam. Professor Mahmoud Salah, Professor Isam Al-Adi, among other Royal College Regional Examiner, with the most eminent Professor Shireen Al-Hariri as one of the examiner experienced in giving courses for MRCS Part B examination. Now it shouldn't be a problem passing MRCS examination. Now we have cracked the code for passing MRCS Part B examination with the help of artificial intelligence and experienced examiners. These are the two unique privileges that we have in this course. Vascular Art Academy is very lucky to have three eminent stars that will help you to boost your career. Professor Mahmoud Salah, Royal College of Surgeons of Edinburgh and examiner of the Royal College. Professor Shireen Al-Hariri, examiner of the Royal College of Surgeons of England. And Professor Isam Al-Adi, a very well-known examiner in the Royal College of Surgeons of England. We have already done the first course in September 26th and 27th, which really have a significant impact and very positive feedback. And they are going to do another course over the next period, not just in October, but as you can see, this is the calendar until end of 2025. So you can have a course in October, November, December, January. During month of Ramadan, we're not going to make courses, but we're going to follow that in April, May, June. We're going to have a course in United Kingdom and Birmingham for Egyptian candidates who have difficulty passing the exam in UK and they cannot come to Egypt. Then we're going to follow August, September, October, November, December. All this information in the reception of Vascular Art. You can book your course in advance and you can ask about all the details of these courses. We are here to help you to pass this examination. Our next coming exam is MRCS Part B examination, which will be 17th and 18th of October under the stars of the Royal College of Surgeons of England, which are going to give all their experience, all their tips and tricks for you to pass this exam safely. We're not going to stop in MRCS Part B exam, but we are going to give also MRCS Part A examination, and we are going to give basic life support course, advanced trauma life support course. We are going to give CRISP course, which is important for critically ill surgical patient. We're going to give OET to improve the English, and we're going to give also courses for MRCS Part A exam. We are your partner in your career to get you the quickest way to pass your exam without difficulty. We are all over the social media. You can have this QR code. We are on Telegram, on WhatsApp, on Facebook, and on Midall. Midall is one of the very exciting media for doctors, which is free of charge and free to join. And the Royal College of Surgeons, all the four Royal Colleges have an account in Midall, and we also have an account in Midall as well. Now we, I think, have cracked the problem that did hurt us for many years. Why Middle East, especially Egyptian candidate, does not pass the first time? Where is the problem? The problem lies on absence of such a course in Egypt before. This course is done by examiner experienced in that field who has worked in United Kingdom for 10 years and above, and we are going to give you all their experience in passing this exam. That is why there is a gap that sometimes candidates fail due to certain gaps in the knowledge. They don't know what is OSCE examination. They don't know how to express their skills to the examiner. In many of European universities, the medical school, they get OSCE training from medical school year one. But for Egyptian and Middle East doctor, this is not the case. They have not trained or used to this system. We are going also to give you the help of artificial intelligence plus the experience of examiners, and we are going to help you to pass the exam without problem, with ease, with high score as well. The MRCS examination is not going to be nightmare anymore. You're not going to be frustrated. We are going to train you to work hard, to work for 3 hours with mental concentration to pass the 17 OSCE station and to pass the exam. After this course, you will have confidence. We'll give you training how to manage stress. We'll give you training how to manage fear. We'll give you training how to answer questions. All we squeeze our experience to give it to MRCS candidates. This course is interactive. You can ask any question. We simulate the exam exactly. With 16 OSCE station, you will be asked to read the candidate instruction, go for the station for 9 minutes, and then you are going to give a personalized feedback from the examiner, tailored to you, not general feedback. We also are going to give you virtual OSCE station over the internet after the exam. So it's a long relationship between the MRCS Academy and you. This is an interactive course. You can ask all the questions that you like, and it is for 2 days, 17th and 18th of October. Book them quickly. The advantage, you will have artificial intelligence optimization of your performance. We have trained the module to help you to pass. You will get all the help and advice of experienced examiner, engage in teaching and personalized feedback. So let me introduce why we are thinking of MRCS examination. It can change your career. It has definitely changed my career, but in my days it was FRCS. It's a great step in your career. You can start working in United Kingdom after having OET exam and getting GMC registration and get ID check. You will be eligible to apply for jobs in NHS. So this exam is judging you that you will be within a couple of months having job and working United Kingdom. That is why you need to have a lot of communication skills as any doctor in United Kingdom. It will make you able to work in United Kingdom after getting GMC registration. It's better than the BLAB route, even less expensive than the BLAB route as well, and it will boost your career. You will get benefit, one of the best postgraduate training center in United Kingdom. So it is a big exam, affect you a lot. In the past, we have only one Royal College of Surgeons of England examining in Egypt, and we had one, then two, then three examination per year. Each exam have around 400 candidates. Now we have all the 4 Royal Colleges doing MRCS Part B exam in Egypt. Royal College of Surgeons of Edinburgh, Royal College of Surgeons of Ireland, Royal College of Surgeons of Glasgow, all the three are coming to Egypt to help you pass this exam. I want you to have the highest passing rate possible. How much do I need to study? Let me ask artificial intelligence. The answer came 4 to 6 months of concentrated effort, and this can involve a daily study session between 2 to 4 hours, focusing on combining knowledge and clinical skills and the mock examination. Which book shall I read from? Very common question. Let me ask this to artificial intelligence. The answer came, core textbooks are three. These are the course three textbook, Clinical Examination Communication Skills MRCS Guide by B.H. Miranda, Get Through MRCS Anatomy by Simon Overstall, Oxford Handbook. And this is from reliable sources, so you can guarantee this is the best answer. You can also have additional resources, which are also three. Belly and Love Oskian MRCS Part B, Mastermind MRCS Part B by Christopher Vaughan, Revision Surgery by Paul Jenkins. All these are additional resources and very helpful. We are going to provide you with many books for passing MRCS Part A and B examination. We'll provide it to you with a QR code that you can download the books and start studying. If you ask the Royal College of Surgeons of England about Part B examination, there is a website which contains all the information. How many stations? What are the type of station? How should I go to the exam? What is the dress code? Everything. I wouldn't go into this detail because it is freely available on the website of Royal College of Surgeons of England. This is the structure of the exam. It consists of 17 examining stations and 2 resting stations. This station will be divided into 4 broad content. As you can see, I wouldn't go into detail because, as I mentioned, all this information is found in the Royal College website. How you are being assessed? You are being assessed in 2 ways. Using a structure mark sheet, you will be assessed by a domain, which out of 20 grades, 20 marks, you will score these marks according to the domain that you are in. In addition, there is an overall assessment for the candidate, which you will either pass, borderline, or fail. Now, this is a website that has not been changed from 2021. This is the last update, August 2021, and you can have it in freely available over the internet, and we'll distribute a copy during the workshop. It is very, very easy to pass MRCS Part B exam. If you attend these courses in Vascular ART Academy, you should not fail this exam at all. There is no reason that you should fail. We'll give you all the advice, all the help, and we'll give you an assessment. We'll tell you what is the percentage of you passing the exam. If you don't have a high percentage, we advise you to come again to pass the exam, and then to improve the points that we let you know about your weak point in passing this exam. If you are well prepared, it's a straightforward, easy examination. Let me discuss quickly physical examination. We need to let you know exactly what you need to read. And you must have a checklist for every station. Here I have collected to you all the physical stations that can come in the MRCS Part B. Nothing will be added to this list. And I don't want to enumerate them, but you can stop the video and see these are all the physical examination station in the Royal College. Let me take one of the example, abdominal examination. We'll just give you one advice. You need a checklist of 15 things that you need to do, and you must memorize them by heart. We advise you to do abdominal examination 100 times. So it will become a natural reflex to you to do proper abdominal examination. Question will be asked during physical examination. They are typical question. In every examination will ask you, can you summarize the finding? So you need to have very good ability to summarize. Any other examination would you wish to perform? Possible differential diagnosis, special investigation, and the option of management. So sometime if you are really trained well in the OSCE style, when I give you abdominal examination, immediately you will summarize the case. You tell me I wish to do PR examination, PV examination, examine genitalia. Possible differential diagnosis of this condition is so. Special investigation, I would like to have an abdominal CT scan. Option of management is blah. This is the experienced MRCS candidate. And this is what we will train you in this course. So you need to read all about these diseases. Again, I have collected to you what are the diseases that come in the clinical examination. This is all of them. You need to read about these diseases, know very well the basics of this disease. We don't ask you anything advanced. MRCS means that you are eligible for a higher surgical training. It is not an exit exam, it's an inlet exam. Remember, speak slowly and clearly during the OSCE station. The official language is English. Whenever we get a patient, we get a translator. But now we rely on actors. And actors speaks English very well. Consider the appropriate facts. Make the best use of the information gathered. Be able to accommodate new information and change management if needed. If suddenly patient showed bleeding or sudden hypertension or collapse, you need to change your management. Always put the patient safety first. Always. And you are assessed for your communication skills as well. Remember wiper. Wash your hand, introduce yourself, position the patient, exposure, and always stand on the right side of the bed. Wiper, wiper, wiper. These are the 15 steps that you need to do. Abdominal examination, you don't start by the abdomen, you start general. And this is one of the fatal mistakes. Wash your hand, ensure patient is comfortable, introduce yourself, make sure that he is not in any discomfort. If you feel any pain, just let me know. Then start by inspection to hands, arms, and you need to tell the examiner what is your finding as you go along, unless the examiner told you no need to speak, just summarize at the end. Then you need to palpate the hand, inspect the head and the neck in the part which is related to the abdomen. Palpate head and neck, inspection of the pericardium, inspection of the abdomen, palpation of the abdomen, examine the spleen by manual examination of kidney, percussion, auscultation. Examining the back is part of the abdominal examination. Observe peripheral ischemia. And these are the further tests that you say at the end, I wish to have examined hernia orifice, and so on. So, let us ask AI how to pass OSCE station safely. Very good question. How can I pass safely? Give me advice. This is the best advice over all the books on MRCS. Passing OSCE station abdominal examination MRCS is all about demonstrating competence in physical examination technique, clinical reasoning. Here are some key pieces to advise surgical candidate. This answer not by me, it's by artificial intelligence. Pre-station preparation, brush up your knowledge, practice the technique, warm your hands before palpating, especially in cold weather if you're going for exam in November. Review the station. Always be careful of the time, because you have 6 minutes to do the examination. So you have always to prepare yourself. You can do it in 6 minutes, and plan your approach well. During the station, maintain professionalism. Show me that you are a professional doctor. You're not hesitant. You're not weak. Your body language is not weak. Follow your protocol. which we said 15 things. Explain your findings. Perform a maneuver with confidence. Integrate your knowledge concerning relevant history. Handle the feedback constructively and manage your time effectively. Now, additional tips. Practice communication skills. And I have trained a model that artificial intelligence can play the actor and the candidate can play his role, and it will give you assessment by artificial intelligence about your performance. Prepare for common scenario. Dress with the dress code in a comfortable dress. Get a good night's sleep before the exam. Practice positive self-talk. Believe in yourself and your skills. Approach the station with confidence and positive attitude. Remember, OSCE examiners are looking for evidence of your clinical competency, communication, ability to apply knowledge effectively. By following these tips and practices, you can confidently approach abdominal examination station. And artificial intelligence say at the end, best of luck to your exam. Thank you very much. I'm sorry it's a little bit of long lecture, but I think in Egypt, all Middle East candidates have a great chance by joining the Vascular ART Academy to get a training for MRCS Part B exam and ask about other courses so you will be ready, brushed up to work in Europe and in United Kingdom. My name is Dr. Muhammad Omar Al Farouk. I'm a vascular surgeon and I wish you all the best.